Okay, so we've talked all about what happens when communication is developing typically, but now we're going to spend some time talking a little bit about what happens when things go wrong. What happens when communication or swallowing don't happen as they should. So you may remember from lecture one, remember that SLPs and audiologists do deal with communication, but SLPs also deal with swallowing. That's something a lot of people don't know about us. And so sometimes things happen as they should, and sometimes they do not. So to start out, we're going to talk about etiology and severity just a little bit. So etiology basically means the cause of something. What caused the disorder? Why did it happen? When we think about etiology, we're going to think about it in this way. So there are some disorders that may be congenital. There are some disorders that might be acquired. So a child who is maybe born prematurely and goes on to experience delays in their communication, or maybe somebody who is born and later on is diagnosed with autism spectrum disorder, or maybe somebody who's diagnosed with a genetic syndrome like Down syndrome that impacts their communication. All of those things would be congenital. It's something that you're born with, something inherent to you. An acquired disorder is something that happens to you to cause the disorder. So typically we might think about things like stroke, brain injury, neurological diseases like Parkinson's or ALS. Those kinds of things are things that you would acquire at some point in your life that would impact your communication or your swallowing. Then when we think about severity, severity of a disorder is described along a spectrum. So we've talked about typical communication already. That would kind of be at the top end. And then we sort of use this staging system to help describe how much impact that impairment is having. So we might say that the severity is borderline if we think it's just kind of on the edge of typical. We might say mild, we might say moderate, we might say severe, or in some cases, we might also choose to say profound, in which case you could expect that communication is significantly impacted to the effect that the person is having substantial trouble in most of their interactions and isn't able to communicate much at all. They also may not have very good compensatory strategies for communication. So if you've had a stroke and you can't talk at all, some people will be able to maybe rely a little bit more on writing to help them communicate, although that can be affected as well. But somebody who has a really profound impairment likely won't have any way to communicate their messages other than maybe some nonverbal methods like grunting, crying, and gesturing, those kinds of things. So I just want to bring you back to the WHO ICF to remind you that everybody experiences their impairment differently. So when we are making a clinical diagnosis as a speech pathologist, that's part of it. We think about how much is this person's disorder impacting their ability to go about their daily life, and that might contribute to the severity that we assign to the label that we give them. So for example, if I'm diagnosing a child with a language disorder, I may be kind of debating between whether I should call it moderate or severe. If that child is experiencing substantial impacts on their daily life, I might decide that severe is more appropriate than moderate, depending on how they're doing. There are lots of different things that play into a diagnosis when you make one. That's not something that's important for you to know for this course, but just remember that everybody experiences their disorder differently. And I also just wanted to remind you that sometimes people do have communication disorders, but sometimes, remember we talked about cultural differences, those differences may just be differences, and differences are not disorders. And I think this little cartoon does a nice job of illustrating that. So you want to make sure always when you're thinking about things that you're thinking about, is this a disorder or is this just a difference that's possibly rooted in culture or language differences, or environmental differences, those kinds of things. Just because something's a difference doesn't automatically mean that it's a disorder. So we know that communication involves many processes. We said that it's really complex. That also means that there are lots of opportunities for problems to occur. And this is a figure from your text that sort of outlines where all of these problems could potentially happen. If you have trouble in any of these areas, communication is going to be harder for you. So spend a little bit of time looking over this figure and getting a sense of all of the different things that could be impacted that could result in communication being much harder than it usually would be. If you have trouble in any of these areas, you're going to have a harder time. So we're going to talk a little bit about language disorders. Remember, we talked about language, what it is. We talked about typical language development in kids and adults. Now we're going to talk about disorders. We're just going to touch on all of the disorders today. You're going to come back to all of these in far more detail throughout the course. So when we think about language disorders, I would split them into two sides: language disorders that are congenital and language disorders that are acquired. So congenital disorders are language disorders that kids have had since they're born, basically. So they may have language disorder associated with a certain genetic syndrome or a certain biomedical condition, like autism, Fragile X, those kinds of things, or maybe hearing impairment. Or they may have what's called developmental language disorder, or what we call DLD. And DLD is basically a language disorder that persists past the age of 4 or 5 with no known cause. So the child has no other biomedical condition. They don't have, they maybe don't have any cognitive impairment. There's not really any clear explanation for why they're having trouble with language. They were just born with it. And then on the acquired side, you might have aphasia, and you'll learn about different kinds of aphasias. Aphasia is what you may get if you have a stroke that affects the speech and language portion of your brain. There are also cognitive communication impairments that might occur as a result of some different kinds of dementia, like Alzheimer's, or possibly as a result of a brain injury as well. So here are some areas of potential language impairment. I'm going to walk you through these a little bit now, but you'll come back to these in much more detail later on. So you can have trouble. Remember, we said the 3 main areas of language are form, content, use. You can have trouble in all of those areas or any of those areas. So if someone has trouble with form, it could take the following different shapes. So you might have a phonological disorder where you make errors in sound usage. So you maybe delete all the sounds at the ends of your words, or you don't realize that consonant clusters have 2 sounds, so you always reduce them to 1 sound when you're talking. While we have this disorder under language here, when we're practicing clinically, we often think about these as speech sound disorders because ultimately kids are having trouble saying the speech sounds that make up language because they don't understand how those sounds are organized into the language system. But phonological disorders would fall under form. You might have a morphological disorder where you have trouble with grammar, so you're making a lot of grammatical errors, like maybe you don't know how to use plurals or past tense correctly. You could have disordered syntax, so maybe you don't understand how to put your sentences together correctly. You might use the wrong word order. You might make run-on sentences because you're having trouble making complex sentences correctly. There are lots of different reasons that these kinds of disorders can occur. You might have sensory limitations, perceptual difficulties, so you're maybe not picking up those features of language when you're listening, so you don't realize you need to use them as well. There might be limited exposure to correct models depending on the environment that a child's growing up in. There could be some neurological disorders that could be contributing, or there might just be no reason. Sometimes kids have trouble with these things and we just don't know why. We can't fully explain it. Then there are some things that can go wrong in the area of content. So you might have trouble using a wide variety of vocabulary words. You might use the wrong words. So like to talk about the paw of a cat, some kids might say it's their foot. It's close, but not quite. That might be an example of a misuse of words. You might have word finding difficulties where you can't think of the word that you're trying to say. That's the word on the tip of your tongue kind of feeling. You could have trouble understanding and using abstract language that's about ideas and concepts. So not things that are around you that you can see and touch and feel. If you're talking about, you know, how precipitation happens in the clouds, or if you're talking about, you know, something that you want to be when you grow up, all of those things are a little bit more abstract, so that can be hard. Problems with content could be due to limited experience. If you don't have a lot of life experience, it's really hard to build the vocabulary that you need in order to manage your environment. You might have a more concrete learning style, so you do best when you're talking about things that are in front of you, here and now. Strokes can cause this, head trauma can cause this, certain illnesses can cause this, lots of different reasons. You can also have difficulties in the area of use. This usually looks like trouble staying on topic, maybe providing inappropriate or tangential responses, or responses that don't seem directly related to what the person before them just said. Maybe you might feel like their responses are kind of disjointed or disconnected or not fully rooted in the conversation that you're having. There might be lots of interruptions. They might have trouble realizing when it's their turn to talk. And this can be due to a few different things. It could be because the person doesn't have great conversational, social, or narrative, like storytelling skills. They might have some vocabulary deficits, and they may also be struggling with phonology, morphology, and syntax. Those kinds of things could also contribute to difficulty with the way that you use that language. There are lots of great examples of language disorders in popular culture, so I've flagged a few books and a few movies and TV shows for you here. I would encourage you to, if you're looking for something fun to read over the summer or something interesting to watch, check them out. Obviously, we always want to be mindful of the way that people who have disabilities or disorders are portrayed in media, and it's really important to read and view things critically, but keeping in mind that some accounts of what it's like are going to be better and more reliable than others. So just a little something to keep in mind, but there are certainly lots of examples of language disorders out there. So now we're going to talk a little bit about speech sound disorders. And when we think about speech sound disorders, I might categorize them in the following areas, and you'll learn more about this again later on. This is just an overview. So we might think about articulation disorders. Remember, we said that's trouble with pronouncing the words. That would be congenital. You might have a phonological difficulty, which we talked about before. So you have trouble using the sounds of a language because you don't understand how that system of sounds is organized. That's also congenital. And clinically, we think of these as speech sound disorders, but remember, they do reflect difficulty with language form. And then on the acquired side, you might have dysarthria, which is a weakness of the muscles in your mouth. We'll talk about that. That could be congenital, like in the case of someone who has cerebral palsy, or it could be acquired. And you might see people who have apraxia, and that's trouble coordinating their muscles for speech. That also could be congenital. That's called childhood apraxia of speech, or that could be acquired, for example, when a person has a stroke. So that's just a kind of quick and easy way to think about how speech disorders are categorized. And let's talk a little bit about articulation disorders first. So remember, we said articulation is the way that you actually pronounce your sounds. So if you have an articulation disorder, it means you're having trouble actually producing the sounds that you're trying to say. Remember, we said that speech sound difficulties, though, could be due to articulation, so that trouble with the actual physical pronunciation, or it could be difficulty with phonology, so understanding how sounds work in a language, or it could be both. And so it's really important as a clinician to understand if a child's having difficulty with articulation or difficulty with phonology, because the kind of treatment that you use might look a little bit different. So you don't need to know too much more about that right now, but I just want you to know that those differences do exist. We would say that both artic and phono disorders are congenital, they're developmental. And often you'll see that kids with articulation disorders usually have trouble with a few sounds, like some that are commonly difficult to say, might be like S and Z, TH, L and R. Those can be some tricky sounds. That's not necessarily all the sounds that kids might have trouble with if they're struggling with articulation, but those are the more common ones. Children with phonological disorders often have trouble with many sounds. So when they're young, if they have a phono disorder, it will often sound like they have more sounds wrong than they have right. Dysarthria, we talked about just a minute ago that dysarthria is really a weakness or a paralysis of the muscles that are required for speech. So when I talk about those muscles, I'm talking about your tongue, your lips, your jaw, and it can also include the muscles that you need for respiration, for breathing. Those muscles could be weak as well, and that will affect how it sounds when you're talking because breath support is so important for talking. This can be congenital or acquired. You can see dysarthria in kids or adults. People who have dysarthria, their speech tends to sound slurred or mumbled, and sometimes they have trouble controlling their rate, so they might rush too much and then get really slow for a minute and then rush too much again. Or they might have trouble controlling their loudness, so they're either not loud enough or too loud and they have trouble finding that middle ground. Lots of different causes of dysarthria, including cerebral palsy, brain injury, Parkinson's, ALS, other neurological conditions can also cause dysarthria. So apraxia, we said apraxia is difficulty coordinating the muscles that you need for speech production, and it's an issue with motor programming. So when you're talking, your brain makes a motor plan that determines how all of your muscles are going to coordinate for speech. And in apraxia, there's a problem with transmitting that plan. Your brain makes the plan, your muscles should be able to execute the plan, but somewhere the plan gets interrupted along the line and your mouth can't actually execute it the way that it's supposed to. Your strength is normal though. So remember we said dysarthria, there's a lot of weakness. That's not the case in apraxia. In apraxia, your strength is good. It's just that there's some kind of error in transmission. So it can be congenital, where you have childhood apraxia of speech, or it can be acquired. For most congenital cases, we usually don't know why it happened. Kids are just born with it. They have a lot of trouble learning to talk because they can't get their mouth to coordinate properly, and there isn't really a clear explanation, which can be really hard for families. A lot of acquired cases are caused by strokes, brain injuries, tumors, traumas, or other neurodegenerative diseases. Someone who has apraxia often has speech that is very hard to understand and is full of many errors. They may talk very slowly. Their prosody may sound unnatural, so their pitch may sound really flat. They can't necessarily manipulate it very well. They may sound kind of halting. And in very severe cases with both kids and adults, they actually may have no speech at all. There are some people who have apraxia that's so severe that they need to use some kind of assistive or augmentative communication device because they aren't able to talk. Okay, we'll come back to this slide in the next recording.